prevent the chaos that can happen, like what happened with the COVID-19, we stopped for a moment and thought, are we actually doing it correctly? Is anyone at risk? Are we actually doing what should be done? Should we persuade people so hard to receive telemedicine services and to give telemedicine services? So to answer all those questions, we thought we should go through the journey of accreditation to make sure that actually we are answering all these questions. And I'm happy to tell you that after the accreditation process, we didn't just answer these questions, we even had more wins than we expected. So as my colleague Caroline was saying, best practice is the main issue, as this is a medical practice. So actually we made sure through the accreditation process that all the physicians were practicing telemedicine according to the available guidelines. And because it's a university hospital, we were able also to persuade the physicians to have research projects where the telemedicine guidelines were deficient over the world. And also because of the accreditation process, we were able to put down the business model into on paper and to introduce it to the administration and make sure that it was clear to everyone what the business model was. One of the great benefits, maybe a personal benefit because I'm responsible for the executive part, was the workflows. And I'm not just talking about the workflows, the telemedicine workflow and its integration into the healthcare services that we offer. I'm also talking about the workflows for training the physicians, credentialing them, the marketing procedures that we had, how to market the content and everything, risk management, quality assurance and improvement in collaboration with our quality management team. So once I had everything written down, organized, it was there, but it wasn't as organized as after the accreditation. It was very easy and very efficient, and recruiting other members that could do this job made it much easier and made it sure that we're all doing the same thing the same way. Another important point was the competency of the physicians or providers that we had on board. Of course, telemedicine is a new or relatively new way of offering healthcare services. So none of us actually did have any formal training in telemedicine when we were in college or even postgraduate. So we wanted to make sure that all physicians had some sort of minimal set of skills to be able to know or to be aware of what telemedicine is and what it offers. Despite after COVID, telemedicine has been used widely, a lot of physicians still are not aware of what telemedicine is and how to use it. So one of our great achievements that we never thought accreditation would help us with was that we have now an undergraduate course that is offered to our students, and it was very successful last year. This year they gave us even more credit hours, and we're thinking of having it for all years and even as a postgraduate course also. I've also been requested to provide some sort of training, even if people are not going to practice telemedicine, for senior staff also. Another important point is that we wanted to make sure that telemedicine as a tool is actually increasing access to healthcare services. So to make sure that actually it is fulfilling this part, we had to make sure that people knew that we had a telemedicine service and how to use it. And this was through our marketing campaigns. And we had some awareness campaigns when the COVID pandemic started to become less invasive. A lot of awareness campaigns in the clinics. Some of our students went there and talked to the patients and told them the benefits and the limitations of telemedicine, how to use it, and it was very successful. These campaigns were very successful. Access was not just to increase healthcare access, but to increase the access of users to telemedicine. It doesn't make sense if I have a telemedicine service that's excellent, but neither the physicians nor the patients know how to use it. So over the last year, we've been developing our service very much. It has become so user-friendly. Even sometimes people with minimal knowledge are able to use the services. They have confidence now with the awareness campaigns and with the marketing. They know how to use it, and the adoption of the users has increased exponentially. It was also important for the patients to know that the telemedicine service is not a standalone service.
So when we had the workflow that explained that this is integrated in the general healthcare services of Ain Shams University hospitals, they felt that they won't have to have two physicians managing them or two lines of management for them. So we made sure that there was a continuity of care for the patients. 2 points that actually we didn't expect telemedicine to help us, the accreditation process to help us with was the financial and legal parts. So far, we are not, patients are not paying for the service, and the Ain Shams University is doing it as a community service. We don't have still proof of cost effectiveness, but they have been persuaded to do research in this domain. And also, it was enough for them to know that patients, the number of patients presenting to the ER and to the clinics, to the outpatient clinics, will be decreasing with the telemedicine service. So this was enough for them. Plus, we are hoping to persuade the insurers, because we have a new insurance program for patients, to be able to include telemedicine in it. And then I was surprised actually 2 days ago that I got a tax, an email from the taxes, even though that we're not asking patients for money, but it meant that we are in the system, which was good. One of also the wins that we never thought of was because when we started talking to funding bodies, when we told them that we were accredited by a renowned accrediting body, URAC, actually we were more credible, and they were hoping to give us the funds, and we had a better chance than when we weren't accredited. Regarding the legal part, actually, we were approved by the Supreme Council of University Hospitals in Egypt, but also accreditation gave us an add value. And we have been invited because of the accreditation to contribute to the drafting of the legislation of telemedicine in Egypt, because actually we aren't legislated yet. It has also helped us with the cross-border telemedicine consultations, especially in countries where also telemedicine isn't legislated yet. So we usually have a lot of consultations, institutional agreements with African universities. And this has helped us to write or draft the agreements better, because now we know what are the terms and conditions that have to be included that ensure patient safety and physician safety. And also for the third-party technology providers, also those agreements are much more mature than they were in the beginning. So this is a quick look at the wins. And as you can see, we've won a lot from the accreditation thanks to URAC. And I'm looking forward to accrediting the rest of our telemedicine services that we're currently developing. Thank you very much for this opportunity.